Onc Live Insights is a video editorial program produced by Onc Live.
The BioT3 platform contains both the CancerTYPE, which is an RT-PCR methodology that can determine quite accurately the type of cancer a patient has who has an unclear diagnosis or an unknown primary cancer. That's the one portion of the BioT3 platform. The second portion is next generation sequencing, as well as selected IHC testing or stains and FISH testing. These have been selected for actionability, that is, determining what precision or targeted therapy might be useful for particular patients.
CancerTYPE is an RT-PCR based test which is used to identify the organ in which the cancer arose from. So if you have a patient who has a pathological diagnosis which says cancer carcinoma, unknown origin, or you are trying to determine what subtype of a particular cancer, like say non-small cell lung cancer, squamous versus adeno, then this is a test that could be used to make those decisions. Now this test looks at expression of 92 specific genes and compares it to a reference to see what pattern it most closely approximates. And based on that, they can predict which organ this cancer arose from. And the sensitivity of this test seems to be in the order of 80 to 90% depending on the study you look at that has been reported in the literature so far. So this CancerTYPE test is another tool that's available that could help the practicing physician identify what organ the cancer came from in situations where you don't know after your routine pathology and immunohistochemistry workup. CancerTREATMENT NGS Plus is a platform that is used to test for molecular abnormalities, and where you have testing for mutations, you test for gene amplifications, and also for certain proteins. For instance, this test would not only check for EGFR, KRAS, and so forth in the form of mutations, but also use the FDA-approved tests to look for ALK positive or ROS1 positive patients in the form of FISH test. And it also includes immunohistochemistry markers for certain proteins. So it is not just doing sequencing, but it does sequencing, protein expression testing, and also gene amplification in the form of FISH testing that are all intended to provide the treating physician with targets that they can use, make treatment choices for their patients.